I'm Andreas Inc., and over 10 million people across the globe have Parkinson's, including my dad and my aunt. So, my friend Elliot and I created a machine learning model and an app to help those with Parkinson's more easily assess their condition and live healthier lives. And we've analyzed thousands of data points. And what we found was remarkable. We were able to predict with the machine learning model 90% of the time the person with Parkinson's and the person without. We took X values, mobility metrics, and we took the value of having a person with Parkinson's or being healthy, and we combined them. So immediately when the user opens the app, they're immediately welcomed with a home screen. They can see their score, their balance, their stride. They can join experiments. They can check their meds. Down below, we can see a little graph of the score for the user, which since this phone is not someone with Parkinson's, it's around 0, 1 being a person with possibly with Parkinson's. So if we tap on score, and you can select different days, you can see the outcomes of it and that kind of thing. And same thing with stride, you'd be able to see, what's going into the model, what data is going in. And you can also do experiments with other people. So you can check recent experiments, which there are none at the moment, so we'll add one. So we can do a running experiment, so will running improve our health? And the model will be kind of like the determining factor on if it's successful. So the goal of the experiment is to develop habits to improve people's health, people with Parkinson's health. So you can add habits. You can, just like with your double sport time and stride and score, you can see the group's progress and habits. And the goal is for habits to go up and for the score to go down. There's also a set of settings. There's some accessibility features such as tapping to scroll, so it's more easily, accessible to people with Parkinson's who have tremors. Maybe your medicine will add a med here, so I'll create that. But the cool thing is you can compare it to what the model is getting. So you can see, okay, this medicine I'm taking at 11, but I'm not feeling well at 9, and the model is suggesting that I'm not feeling well at 9 either. It's a really quantitative example of how your medications are working that you can compare with your doctor and see what's working, and even, be utilized by researchers. So that's the app.
Hi, I'm Elliot Cantor, and I work with the data science and Python coding for this project. We've tried a number of machine learning models, but we've ultimately decided on a random forest regression model to predict the severity of symptoms in patients with Parkinson's. Machine learning is a constantly developing field, so we've had to use the latest and greatest technologies. In testing, I've tried random forests, boosted forests, and even deep learning. But we've ultimately settled on the random forest because it's more predictable than deep learning. Random forests work by aggregating the output of several decision trees to have a more predictable and accurate solution. Since we're working with mobility data, which takes the form of a spreadsheet, we use a random forest rather than deep learning because it's more predictable. In addition, we use a regression model as opposed to a classification model because regression models can help give us a score instead of a binary on-off state for if the user has symptoms. The model currently works on the user's phone locally through our app, but I've already created the code for a web API so that any device with an internet connection can predict the severity of Parkinson's symptoms. Our model was trained on thousands of data points as a baseline, and users can choose to share their data with us so that we can further train the model and get more accurate results. We're using the newest technologies so that we can predict the symptoms in Parkinson's patients. Now back to Andreas with the implementation of our app.
So what is the impact of our solution, of our model and our app? Well, first of all, you're 33% more likely to achieve goals when tracking progress. This app allows you to track your progress and achieve your goals through habits. So Parkinson's patients are more likely to achieve goals and be healthier when they're tracking their progress. There's also a 50% decrease in patient mortality when the patient has strong relationships. So that's why we implemented social aspects of the app. And we have 94% test accuracy when predicting Parkinson's with mobility metrics. So the impact is more data equals improved treatments and accuracy upon diagnosis, more connected and motivated patients, because of social interactions and because they're empowered by their data. So feasibility. The app has optimized accessibility features so that people with Parkinson's, especially those who have tremors, can use the app more easily. There's broad access to the data because 80% of iPhone users have mobility metrics on their phones. So implementation, how does that work? Well, we have a fully implemented, accessible social platform. We have full implementation of Apple's Health Kit to access health data. We have a complete construction of an API backend. We have full representation of data. We have an advanced machine learning model, and we have a live app on Apple's TestFlight. So where's the innovation in this? Well, this technology, this data set is new. It was announced in September 2020, so it's a new technology. And we've used the newest machine learning models to train and assess the data. So what's the bottom line? Well, data equals an improved disease-modifying therapies for researchers and doctors to discover. Data equals increased patient motivation, going back to that statistic at the beginning. And social connections equals improved conditions because, like that statistic suggested, strong relationships equal better health. So really, we're trying to empower patients to optimize their quality of life with data and social connections. Thank you.